night, you might go through the routine of putting on pajamas, brushing your teeth, turning the lights off, and locking up your house. But what do you do if after getting in bed, you realize you might have forgotten to lock the back door? You would probably get up and double check to make sure the door is locked and then get back in bed and go to sleep. But a person with obsessive compulsive disorder, or OCD, might get up and check the lock and lay back down, then get up and check again and again and again. Obsessive compulsive disorder can be defined as excessive thoughts or obsessions that lead to repetitive behaviors or compulsions in a way that interferes with everyday life. I'm going to share with you some facts about obsessive compulsive disorder, including signs and symptoms, causes, ages at which it is most commonly diagnosed, and types of treatments. Obsessive compulsive disorder is made up of different symptoms and categories. Symptoms of OCD include obsessive thoughts and compulsive behaviors. For example, a person obsessed with germs and contamination might wash their hands 20 or 30 times a day and avoid contact with all people. Most people with OCD fall into one of 5 categories: washers, checkers, doubters, counters, and hoarders. With all of these different categories, it might make you wonder what causes OCD in the first place. Obsessive compulsive disorder has different causes that researchers are still studying. Sometimes OCD can be genetic. Different parts of the brain are involved in fear and anxiety, so researchers are studying these parts of the brain to learn more about treatments for OCD. Researchers are also looking into stress and environmental factors for a reason for OCD. After learning about what causes OCD, I will tell you when most of this starts for people. Obsessive compulsive disorder symptoms start during childhood or teenage years for many people. Usually it is diagnosed by about age 19. Around 2.2 million American adults are affected by OCD. Numbers of men and women with OCD are usually pretty equal. Here's a chart representing the entire population of the United States. It's about 318 million. This orange sliver represents the 2.2 million American adults that are affected by OCD. It doesn't look like a lot, but it's actually 1 in 40 adults. With OCD being so common in America, there are some different types of treatments available. Obsessive compulsive disorder can be treated with therapy and self-help. People with OCD should try to challenge their obsessive thoughts and behaviors by anticipating them and writing them down. People with OCD should take care of themselves. They can use relaxation techniques, they should avoid alcohol and drugs, and get plenty of sleep and exercise. They should always reach out for support. They can stay connected with their friends and family and even join a support group with other people affected by OCD. In conclusion, I would like to remind you of the seriousness and commonness of obsessive compulsive disorder and share with you a quote about overcoming anxiety and obsessive thoughts by Dan Millman that can inspire a person trying to conquer OCD. You don't have to control your thoughts, you just have to stop letting them control you.